Tungiasis, also known as sand flea infestation, is a parasitic skin disease caused by the female sand flea Tunga penetrans. Characterizing this infection involves understanding its epidemiology, clinical manifestations, and diagnostic approaches. Epidemiologically, Tungiasis thrives in impoverished areas with inadequate sanitation and housing conditions. It disproportionately affects rural populations, particularly those engaged in farming, fishing, or walking barefoot. The prevalence of Tungiasis often correlates with socioeconomic factors, including limited access to healthcare and education. Clinically, Tungiasis manifests as a spectrum of symptoms ranging from mild discomfort to severe morbidity. Initial signs include intense itching and erythematous papules at the site of penetration, commonly the feet. As the female sand fleas burrow into the epidermis, they cause localized inflammation, leading to the formation of characteristic white, circular lesions known as sand flea rings. If left untreated, Tungiasis can progress to secondary bacterial infections, ulcerations, and even gangrene, particularly in immunocompromised individuals. Diagnosing Tungiasis relies on clinical examination and the identification of characteristic lesions. Healthcare providers must differentiate Tungiasis from other skin conditions, such as scabies or cutaneous larva migrans, through careful inspection. Dermoscopy may aid in visualizing embedded sand fleas and their associated inflammatory response. In resource-limited settings, diagnosis often relies on clinical expertise and the presence of typical lesions. Beyond physical discomfort, Tungiasis can impair mobility, productivity, and quality of life. Chronic infections may lead to social stigmatization and psychological distress, particularly in affected children. Additionally, Tungiasis contributes to the cycle of poverty by exacerbating existing health disparities and hindering economic development. In conclusion, the characterization of Tungiasis infection involves understanding its epidemiology, clinical features, and broader socioeconomic implications. By addressing the root causes of transmission and implementing comprehensive control measures, we can mitigate the burden of Tungiasis and improve the health and well-being of affected populations. Please remember to subscribe to our channel, click the like button, and activate the notification bell if you wish to see more content like this. Thanks for watching.